Okay, so what are the risk factors and the causes of glaucoma? Age is a big risk factor. We would say your risk starts to go up significantly. About 10% of glaucoma patients are over the age of 80, but there's other aspects of, or I should say 10% of patients over the age of 80 have glaucoma, but your risk starts going, particularly if you've got family history after the age of 40. Family history. If you've got a family history of glaucoma, you've got 4 times more likely to have glaucoma. Ethnicity. So different forms of ethnicities associated with different forms of glaucoma. Europeans are associated with more open drainage angle glaucoma. Asians, more with closed drainage angle glaucoma. If you have medical conditions such as diabetes, hyperopia and myopia, which is very long-sighted and very short-sighted, that also increases your risk of developing glaucoma. And then other factors. So if you use a lot of corticosteroids, so patients who've got asthma, eczema, if you've got injury to your eye, some patients who've got very thin cornea, so these are all aspects that we will be checking when we assess the patient. Or if you've got certain medications that can also precipitate glaucoma, so that includes tricyclic antidepressants and anti-seizure medications. So I do a lot of talks with GPs, and I always tell them that whatever medications they prescribe, they really have to think about potential risk with glaucoma, because some of the commonly prescribed drugs, including antidepressants, can also trigger glaucoma in some at-risk patients.